The National Business Compact on Coronavirus, a coalition of like-minded partners, was set up in March 2020 to respond to the complex, rapid-onset emergency and a systematic shock of COVID-19. It intends to reach more communities and populations across East Africa. This mobilization ambitiously targets at least 75 million people in Kenya, Uganda, and Tanzania by April 2023. Through Global Hand Washing Day, activities to eradicate diseases like COVID-19 and Ebola that has sprung wild and would affect the economy.
Working in that framework. Now, when you ask about stopping, you would be suggesting that there should have been a kind of either quarantine or a lockdown somewhere to stop cases from spreading. Unfortunately, that was considered, but when you look at where our economy has been, and the rates of cases happening, that did not warrant us to have a lockdown. So you have to strike a balance about people's livelihoods, the economy, and also put in place a lockdown.
Private sector is also contributing greatly to this campaign.
Not enough you can spend on health and life, right? It's never too expensive. We start there, right? Number one. Number two, as a business, we have the responsibility to innovate solutions that are as cost-effective as it can get, yeah? And when it comes to, everything has gone up, for example. So is health, the cost of health as well, yeah? But I think the principle is, how do we figure out solutions as a business that provide the same quality product, more effective, at a less cost? That's the cost, that's the discussion.
It means the safety of our business. And the reality is, we cannot be operating and making a successful business in an area where there are very unhealthy people. And this is fundamentally why we have joined, and we have continued to commit that we'll use our available platforms, if it means our reflectors, if it means our helmets, if it means inside our app, if it means using our different social media platforms to disseminate and share this information, we'll make use of it. We also committed that we have a huge network of partners that we work with, both in the border communities. You know, there are over 54 registered border stations, and also there are close to other 10 companies that are in the ride-hailing space.
When asked about the status of financing, NBCC was responsive.
Idea of how you can put public sector money and private sector money to be able to then deliver via some of the implementing partners that we're talking about. I think what we've seen also on co-financing is not always in direct additional cash, but it's also more around, for example, taking Copia. For example, we can go via all the distribution channels and make sure that every single person in there has access to our materials, right? So, or we're talking about Equity, Equity Bank, who's, decided that every single one of their distributors would be able to be part of that. I think when we talk about co-financing, it's more around what additional resources we can bring to scale this campaign as well. So it's not always cash.
To date, over 30 organizations have partnered with AMREF and NBCC, ranging from digital media agencies to social businesses, community organizations, retail companies, funding partners, and more. All are aligned with core goals, with each one bringing something different to the mission of refreshing public commitment to hygiene and self-protective social behaviors. Rona Nahabwe, Business Today, Smart 24.